Hello and welcome to the Australian Commission on Safety and Quality in Healthcare's webinar on partnering with service users in digital mental health services. My name is James Caddy and I'll be your host today. We start the session by acknowledging the traditional owners and the custodians on the land on which we meet. I'm coming to you today from the lands of the Gadigal people of the Eora Nation. I pay my respects to elders past, present, and extend a warm welcome to Aboriginal and Torres Strait Islander peoples joining the discussion today. It's important to recognise people with lived experience of mental ill health and recovery and experience of people who are carers, families and supporters. Whilst we don't anticipate attendees will be impacted by the content of today's discussion, do reach out to a trusted friend or one of the 24-hour crisis support numbers listed on the screen if you find you need additional support. Today, we focus on the importance of partnering with service users to create a person-centred digital mental health service in which service users are included in shared or supported decision-making, partners in their own care, and involved in the design. In the standards, a digital mental health service is defined as a mental health, suicide prevention, or alcohol and other drug service that uses technology to facilitate engagement and the delivery of care. This includes services providing information, digital counselling services, treatment services, and peer support services via telephone, video conferencing, the web, SMS, or mobile health apps. The standards aren't intended to apply for more generic wellness services that do not offer specific mental health services. However, providers of wellness services may use relevant components to guide their service delivery expectations. Within the platform we're using today, you'll find a guide to resources to help you partner with service users, as well as a hyperlink to the Commission's website for further information. And a warm welcome to our guests, whose biographies are accessible through the platform. We have Dr. Victor Storm, Senior Clinical Advisor for the Digital Mental Health at the Commission, consumers Judith Drake and Ricky Spencer, carers Mim Gardner, Simon Johnson and Eileen McDonald, and service providers Rachel Green from Sane Australia, Emma Elder from the Black Dog Institute, and Kirsty Olroyd from Beyond Blue. We encourage participants joining us today to make use of the discussion function on the platform. We're also interested to hear your questions, so make sure you put in a question in the Q&A function as we hear from each of our speakers. So let's begin by moving to Senior Clinical Advisor for Digital Mental Health, Dr. Victor Storm, for some comments to open today's discussion. Thank you, Dr. Storm.
Thank you, James, and welcome everyone. Today, I shall outline the key themes and actions that comprise the standard and highlight some implementation questions that service providers might consider. Mental health care based on partnerships can benefit many different groups, such as the individual service user and healthcare worker, the specific digital mental health service, and the service provider overall. The standard consists of 3 criteria or themes: partnering with service users in their own care, digital and health literacy, partnering with service users in design and governance. There are further sub-themes or items below each of these, and I'll now outline them a bit further. Person-centred care is the gold standard in healthcare delivery. Partnering with service users in their own care is a key pillar of person-centred care. Given the variety of digital mental health services, partnering with service users may comprise many different and interwoven practices, from communication, structured listening and shared decision-making, through to self-management, support and care planning. Under this criterion fall other important themes relating to patient rights, informed consent, and supporting service users to make decisions about their care. Action 201 requires providers to ensure service users are made aware of their healthcare rights and, in turn, that their rights must be respected by service providers. In particular, the provider has a Charter of Healthcare Rights. Action 202 and 203 required service providers to ensure appropriate informed consent is explained and obtained whenever it is relative to the processes and services. And Action 204 asks providers to ensure users are supported to make decisions about their care whenever possible. Turning to the second criteria, digital and health literacy, the next major theme in the standard requires provider to take account of these factors in understanding the literacy of health service users, and that the communication occurs in ways that supports effective partnership. Health literacy refers to how people understand information about health and healthcare and how they apply that information to their lives and use it to make decisions and act on it. Digital literacy refers to the ability to identify and use technology confidently, creatively, and critically to meet the demands and challenges of life, learning, and work in a digital society. A major sub-theme of this criterion is ensuring the provider communicates in ways that supports effective partnerships. The fifth and sixth actions ask service providers to tailor their communication to meet the diversity of service users. This may include considering language, cultural factors, and digital literacy. Criterion 3. This criterion asks the service provider to partner with users in the design and governance of the service. The seventh action asks providers to think about such questions as: how does the service provider involve service users in the governance, planning, design, measurement, and evaluation of services? What processes are in place to ensure that the diversity of service users is reflected in these partnerships? How does the service provider review and evaluate their partnering processes? Whilst the eighth action further asks the service provider to consider ways in which they can support service users through training, orientation, and education to help users partner meaningfully with the provider. The ninth action asks the service provider to explore ways in which they partner with users to incorporate their views and experiences in workforce training and education. Promoting usability or the user experience is a key theme in this criterion. This involves ensuring optimizing the user experience in terms of function, cultural safety, service user feedback experience and satisfaction, service user outcome, and access. The 10th action asks service providers to think about: how are service users involved in the development and review of the service to optimize functionality? How is the cultural safety of the service assessed and by whom? How is the use of the service by the intended users optimized? And what processes are in place to assess the level of satisfaction of service users with this service? Related to usability is accessibility, and this is the focus of Action 11. This involves partnering with service users to minimize barriers to accessing services associated with the technology platforms of the services, or the language, location, age, culture, and ability of the service users and their support people. To ensure services are compatible with commonly used assistive technologies, that they meet relevant standards for web page or web application, and that they regularly review access to services and take action to improve access by service users and their support people. Remember that partnering with service users will enrich your service in many ways. It will provide you with practical insights into safety and quality improvements. This may involve some challenges, however, the goal is mutually beneficial outcomes. This will enable you to meet the gold standard. Thank you.
Great, thank you, Victor. Those comments really highlighting the value of partnering with service users and the range of areas in which partnerships can make a valuable contribution. We now welcome the perspectives of consumers, starting with Judith Drake, who is a consumer representative on the Digital Mental Health Advisory Group of the Commission. Judith will be followed by Ricky Spencer, who is a co-chair of Rainbow Voices LGBTQI+ People Living with Disabilities Australia. Thank you, Judith and Ricky.
Hi, I'm Judith, and I'm a consumer rep on the Commission's Digital Mental Health Advisory Group, and I'm on Wurundjeri country today. I've been involved with various organisations over many years, including some who deliver digital mental health. If you're thinking of asking consumers to be involved in your work, it's really important to think about why you're doing this and how you can make sure you do it well. I first got involved in this space after having some poor experiences with a provider. When I gave them some constructive feedback, I was invited to contribute to some staff training and then applied to join their consumer reference group, where my experiences could help to improve the way they did things across the organisation more broadly. But I've also had experiences of making complaints that have led to a very awkward meeting or phone call with a senior manager where they've got a bit defensive, I've got a bit upset, and at the end of it, apart from maybe receiving a letter of regret, nothing much has changed, and I've wondered why I bothered speaking up at all. All too often, we're invited to be involved with something only to find the experience is frustrating, tokenistic, and invalidating. This diminishes genuine engagement and can leave us feeling very vulnerable and exposed. The best experiences I've had partnering with service providers have been when they've been genuinely committed to the process, when they've taken the time to create a space where I feel safe enough to be honest about my experiences, where I've been valued as an equal. But at the same time, there's also been an acknowledgement that this work is inherently personal, and sometimes I might need a little extra support or time. Are you wanting to partner with consumers just because the standards say you have to? Or are you genuinely wanting to support us to use our expertise to improve the services you provide? Because we will be able to tell the difference. Getting a great induction is essential. Sometimes some training or a pre-briefing can be incredibly helpful, and it's always better to include us from the beginning of a project rather than expecting us to just sign off on a draft you've already developed. If other people working on a project are being paid for their work and skills, then I expect to be remunerated for my time and expertise too. It's incredibly helpful to have some flexibility around when work can be done. And don't email me at the last minute and expect something to be done by the next day. It's not only unfair on me, but it doesn't allow me to get my thoughts together and to do my best work. And don't even get me started on the overuse of jargon and acronyms. It's just TMI for the synaptical connections in my neural networks and leaves me asking WTF. When you involve us in a project, ideally it will aim to be co-produced with the right mix of people the whole way through, from initial concept right through to evaluation. But if you're only able to do consultation or engagement, at least make sure that you get back to us with regular updates and close that feedback loop. One of my pet hates is when an organisation calls something co-design, but it's really just consultation. Sure, not every project can, or indeed should, be co-designed. But if you call something co-design, you need to make sure that it is a genuine partnership where power is shared equally by those involved. I would even suggest that to do really good co-design, you may have to be willing to risk having a project fail, go back to the drawing board and start again in order to be truly innovative and collaborative. It's also worth being mindful of the dynamics that can exist when you bring a wide range of people together. I've had occasions where I've found myself on committees with doctors who have actually treated me in the past. In a room full of professors, clinicians, bureaucrats, and executives, it can be easy to feel overwhelmed and intimidated, where imposter syndrome gets added to my long list of other diagnoses. Taking the time to establish a safe space that incorporates trauma-informed principles can be beneficial for everyone, and having a dedicated liaison person I can go to for help or advice, or even a more formal mentoring process if people are new to this work, can also help. Other things I've seen work well include having a consumer co-chair for committees, having lived experience voices at board and leadership level so that all policies and procedures are reviewed through this lens, working with reps to see if they need any extra practical support, such as live captioning, chat function, debriefing after meetings, printing out pre-reading materials, additional support with travel, and so on. Including and privileging diverse voices, such as people from rural and remote areas, culturally and linguistically diverse perspectives, First Nations voices, and people with a disability, can lead to much better outcomes. And please never rely on only a single lived experience representative to have to carry the burden of this important work. It's also important to remember that whilst clients of your service can be some of the best people to help you understand and improve what you do, it can be hard to speak up when you're critiquing a service you're still dependent upon. Please keep an open mind to what we have to say and try to avoid becoming defensive whilst appreciating the various power dynamics involved. Partnering with consumers is more than a task, it's a mindset that needs to permeate every aspect of your organisation and be embedded in your values and reflected in your culture. It takes time, effort, and a deliberate intent to find, recruit, train, and collaborate with people with diverse lived experiences. But if you can manage it, the products and services you develop are much more likely to be fit for purpose, high quality, and to make a real difference in our lives. Thank you.
Hi, I'm Ricky Spencer and I'm a health and media sociologist. And today I'm going to speak a little bit about the importance of having digital health apps that really take into account intersectionality, as this is one of the most important ways in which people who are from marginalized communities can actually be able to connect with a device and really be able to form a relationship with the device. Now, one of the things that I'm really keen on is to making sure that the user-friendly interface is something that is embedded in the planning and also within your algorithms that you do. So one of the first key features I would always ask or look for when I'm helping analyze and write about devices is, does this particular device take into account gender diversity in the community? Now, for myself, who is transgender, I look for, will the app be able to identify me as in my own embodiment, and will that information through your AI technology be able to consolidate that health information in a way that builds a concise picture for those that may need that information by my medical professionals that use my data to have an informed opinion about what treatment services that I may require. One of the other key features that's important for those who are neurodiverse is considering, can I somehow personalize the icon for that particular health app so it will stand out from the other apps? Now, at the moment, I know that that's not possible, but that is something that would be wonderful in the future to consider, because if we could have a digital health app that's a little bit bigger icon than the rest of the other apps, what that would be able for us to do, who is also dyslexic, is look at that particular app straight away on our phones or our computers and be able to navigate on that tool quite quickly and get to that particular icon and then start our processing of whatever information we need to extrapolate and talk to whatever telehealth service that we may need to access. One of the key features of the telehealth service that from my experiences as well is when you create virtual waiting rooms is to also consider, how can I have that experience to help those of us who have anxiety and perhaps may need to kind of have a time to relax as you would in a physical space setting. So perhaps giving people the options of whether they'd like to listen to some music, whether they would perhaps like to listen to some podcasting, or maybe do a little gaming to kind of relax them, to get them into the mood just before they have their appointment. Another important feature to consider is also, how can I also manage that if English is not my primary language? So we have a lot of people in the communities who are also those who struggle with language and looking at the update, so perhaps making them an easy read features. Overall, the most important thing is to really consider people like myself in your co-design process and having us test out the products in real time so we can then give you the best feedback.
Wow. Thank you to Judith and Ricky for highlighting how rich and valuable the insight can be when you really listen to a diverse range of consumer voices. A quick reminder to post your questions and comments on the platform so that we can have those ready for the panel to address during the Q&A session. I'd now like to introduce some carers who have lived experience supporting loved ones with mental health challenges. We'll hear from Mim Gardner, Simon Johnson, a carer peer worker, and Eileen McDonald, Chair of the Commission's Digital Mental Health Advisory Group.
Hi, my name's Mim, and I've been caring for a family member experiencing mental illness since I was a teenager. Digital mental health has been a great additional support for me, and at the same time, a challenging one for the people I care for. As a carer, I do prefer face-to-face meetings, but often I've had to cancel as I've required to support my family members, and it was just not possible to attend due to my caring role. Digital mental health gave me the flexibility to access the support I needed. It allowed me to schedule appointments at times when I knew I could maintain my caring role, my commitments for work, be available to provide support, and maintain confidentiality when required, even if that meant sitting in my car. I now use digital mental health regularly to maintain my well-being. However, this was not the case for my family member. Face-to-face meetings are really important so they can assess the whole environment and the person. This helps them understand the situation and feel safer. It takes some time for my family member to get comfortable with a new person, as they can become overwhelmed trying to build that rapport and trust. My family member relies regularly on mental health appointments. Missing one is not helpful for their well-being. So when face-to-face meetings were cancelled or reduced due to COVID, this was particularly hard. They found digital mental health very challenging and became non-engaged, frustrated, and sometimes angry when they were trying to process and understand what was being said. They can have really invasive thoughts about the person they're speaking to. For example, can they trust that person? Are they being recorded? Could this recording be used elsewhere? Is the person making nasty or disrespectful gestures outside the frame of view? Or are they just writing something that they shouldn't? This can happen even if they already know and trust the service provider or person. Experiences like this can cause dysregulation, needing time to recover, and usually requiring support. My family member and I spoke to various providers about this and worked with them. One provider helped reduce my family member's anxiety about digital mental health by introducing activities and the session to try and shift that negative focus. We also collaborated with another service provider to use one of our favourite strategies, and this was driving around looking for cows. This would not have been possible without the willingness of the service provider to make reasonable adjustment to how the session was delivered. Even though my family member has improved their online capability, they still will not do group sessions online and prefer face-to-face. However, we now know that they can ask for adjustments and use strategies to help. As a result, my family member can participate in one-on-one digital mental health sessions if they're feeling strong enough and there's no other alternative. Thank you.
G'day, I'm Simon. Thanks for your words, Min. My insights relate to supporting my loved one to use digital mental health services and my own experiences of using them, as well as providing IT support for online carer support groups. My loved ones were particularly impacted by the COVID lockdowns. The loved one that I care for at home, because of their severe mental health challenges, became extremely unwell because of lockdown and the social isolation, especially with paranoia and auditory and visual hallucinations. They found it very challenging to use digital mental health services when they were paranoid and they thought they were being tracked. They ended up only using them when they were well, and when they were unwell, we would use telehealth, mainly on my own phone, not their own. This was very challenging for me and impacted on my own privacy. For me personally, it was online support groups that saved me throughout COVID restrictions. I was often locked inside with no contact with other mental health carers. Through a community-managed organisation, there was a regular mental health carer support group I would attend online, where we would share lived experiences as family carers. For the last few years, I've also provided the IT support for the online carer group. During COVID, I also needed to use a private therapist online for my own mental health needs. Confidentiality and safety is a continuing challenge. As we live in a small apartment, the effects of my family members' privacy and my own when we use online mental health services. When my family members is coping well, we can negotiate the situation for our mutual privacy. And when they are unwell, it's a real challenging, as they still insist on using my device. This continues to affect my privacy. I'm grateful there are the digital mental health standards, because it will help me and other family members know the digital health services are safe and confidential, and that our data is protected. Thanks. Now I'll hand over to Eileen.
Hi, my name's Eileen. My family and I have used digital mental health services for many reasons over the years. We've used it for counselling, crisis, suicide prevention, peer support, assessment, and for information. Some digital services have been part of a therapy treatment plan together with a therapist, or we've individually selected and self-managed. We've used many methods to access digital mental health services through telephone, text messages, chat functions, online forums, video conferences, and lots of apps. Depending on what my family have asked, I have supported them with deciding which services we use or they use, how to get and use some of the digital programs, making and remembering appointments, and managing the costs of data. How often I'm asked to support a family member with their mental health services depends on how they're functioning on the day. Because of their psychosocial disabilities from mental health and their other challenges, some of my family fluctuate in their ability to use digital mental health services. I can never assume or predict the support they might want from me with their appointments or using programs. Also, some family members will not let strangers assist them. It's been important for all of us in the family to respect each other's needs for privacy when anyone's having a digital appointment. We've all learned to be flexible and creative to find the privacy we need, even if this means sitting in the yard, going to a park, or even when walking our dog. For my own mental health needs, because I live in a regional area, digital mental health services have given me access to a wider choice of providers and to not have to use someone local or travel to appointments. I also like using digital mental health programs that I can use whenever I want, particularly programs that will be specific to my needs and that do not require my personal information. Although I really appreciate the convenience and variety of digital mental health services, I need for myself, and my family have said they need to know how to identify the digital mental health services we use to know which will be safe, reliable, or consistent in their quality and their safety. We all want to control our own health information and make sure our privacy and data is protected. I know that we all want the feedback that we and all service users should provide to plan and to evaluate digital mental health services, to be valued and contribute to improving services and the outcomes for everyone who uses these services. We will all be looking for the digital mental health services and programs that are accredited by the National Digital Mental Health Standards so that we can all have this assurance. Thank you for listening today.
Thanks, Mim, Simon and Eileen. That really helps us understand the vital role of partnering with carers for safer and more effective digital mental health services. And now we're going to hear from Sane Australia, Black Dog Institute and Beyond Blue, 3 prominent mental health service providers on which different ways than when they partner with service users. First, we hear from Rachel Green, CEO of Sane Australia.
Thanks. It's great to have this opportunity to share with you Sane's approach to partnering with consumers. So I want to talk to you a little bit about our guided service. This is the pilot program we've been delivering since it was first designed in 2021. In designing the guided service, we took very seriously our responsibility as a lived experience-led organisation to partner with people with lived experience very deeply to undertake that design journey. So with a group of more than 60 individual co-designers who included Aboriginal and Torres Strait Islander people, people who are culturally and linguistically diverse, LGBTIQ, we worked with them to understand what was missing for them in the health services that they either could access or were struggling to access, what was missing for them in a sense of community, and what were their service goals. And we co-designed and co-produced our services, our service model, and our digital platform. In taking that forward into design, we actually made sure that we coupled together both standard digital design principles, user experience and user testing, with lived experience. And so at every step of that process, we ensured that lived experience participants were part of the design groups, but also through our lived experience framework and governance structures at SANE, we ensured that lived experience leaders in the organisation were overseeing the project and the decision making to make sure that we were coming up with a service that would meet the need that had been identified by the community it was intended to serve, but also, and this is a really critical point, that it was designed in a way that would make it measurable. That's a really important learning outcome I'd like to leave you with, is that making sure that your insights are going to be measurable, and measurable at the individual and at the service level, where you are able to see not just that you're delivering what you intended, but that it is rated by the people who are using it to have achieved the outcome that you are seeking, is absolutely critical to making sure you really are achieving those goals through partnering with service users. When we moved into implementation, one of the things that was absolutely critical for us was then understanding the user experience. And we use both active and passive mechanisms to do that. So active mechanisms would include standard service feedback and surveys and evaluation mechanisms, but also being very mindful of the sort of soft signals that come through. So listening to staff within the organisation, particularly lived experience staff working within the service, who build a really strong rapport with the people we serve, but also measuring the satisfaction scores. We ensure that people who use our services are able to rate them in real time, and we invite and capture both feedback and also complaints and critical feedback as it's submitted. I consider that to be one of the richest sources of insights into how a service can improve. So coming up to understanding evaluation and accreditation. For those of you who are just starting to explore this set of standards and what it might look like to either, whether you're getting ready to think about partnering with consumers, if you're looking ahead to the digital standards and what they might mean, I can't say this strongly enough. You want to make sure you're starting with the right mindset. Don't go into this with a tick box mindset. Make sure that right from the board level, you are understanding the value of knowing what consumers of your service think about your service, what it is that they want, and be committed to learning and changing your mind. In fact, if what they have to share might be different to what you thought you were setting out to achieve. And I guess also, you don't want to go into this process thinking, how do we pass? You want to go into it thinking, what can we learn and how might we change? And be ready for power sharing. Be ready for processes that might be at times critical or different to what you had expected. I would suggest also it's important to acknowledge that partnering with consumers and going on that journey of change, much like a digital transformation journey, is a really deep journey of change for any organisation or service. It isn't one to be done quickly, and it isn't one to be done lightly. So approaching it as a change journey for an organisation or a service, and approaching it with enough time and beginning with education is really, really critical. Start by educating everyone on what it means to partner with consumers. If working with lived experience is brand new, then start with some of the foundational documents that have been produced by peak bodies in Australia, mental health commissions, and particularly consumer and carer peak bodies in each state and territory are a really great source of advice. And some of the information available on our website, sane.org. Make sure also that you are embedding lived experience throughout the process. So one of the things that was incredibly valuable for us at SANE was actually the experience of service users in our audit process. We had over 50 participants in our services put their hand up and volunteer to be participants in the process. And then our auditor undertook sort of 30 to 40-minute phone conversations with service users. The insights coming out of those calls were some of the richest feedback we've actually had, and many of those conversations have actually led to new design, new thinking and new enhancements that will add to features, to efficiencies and to improvements across our organisation. So coming back to that first point, don't go into this with the mindset of how do we pass, go into it with the mindset of what can we learn, what rich insights might we gain. I would suggest also make sure that you're thinking about the individual needs of service users and make sure that your process is accessible. It's really important to remember that people are going to need different types of support to actually participate in any co-design or co-production journey. So think about accessibility, think about what types of different formats people might need. Not everyone is going to feel comfortable, for example, coming along to a focus group or being in a session where they might be in a room with people who are quite senior in your organisation or being on a video Zoom group. So think about different formats and different mechanisms to actually partner with consumers all the way through from the design process to review and feedback. You want to apply an it's okay to complain and it's okay to input methodology and really make it as easy as possible for people to share with you. Lastly, I would say don't avoid and in fact encourage the critical service user because they may end up being your best asset. Partnering with service users has so many benefits, actually not just for delivering better quality services, but actually for business improvement, for greater efficiency. There are business outcomes as well as quality outcomes to be gained by going through this process. And going into it with that mindset, we'll see it pay dividends for the future.
Black Dog Institute is the only medical research institute in Australia that investigates mental health and suicide prevention across the lifespan. We pride ourselves on being at the forefront of translational research, integrating our research studies, education programs, digital tools and apps, clinical services, and public resources to pioneer best practice suicide prevention. What does consumer engagement, or the term we use within research is lived experience engagement, look like within a research institute? Working with people who have lived or living experience is essential for producing more inclusive, relevant, and impactful research. Within mental health research, traditionally people with lived and living experience have been involved by participating in surveys or interviews. We're now seeing people with lived and living experience partnering with researchers to develop research across the research lifecycle. While there are policies and processes supporting engagement at government level, the methods and the level of engagement is inconsistent. At Black Dog, we have had a lived experience team for the past 4 years with all staff members in identified roles having lived and living experience. Our aim is to support researchers in working in partnership with people with lived and living experience using both evidence-based and best practice methods developed by and with people with lived and living experience. To support this, we have developed a lived experience engagement framework. Black Dog has embedded lived experience engagement in all of our work by making it a strategic objective. The framework provides a consistency of practice, experience and understanding in how we engage and partner with people with lived and living experience. It supports Black Dog's commitment to embedding the voices of lived and living experience at all levels across the Institute, including within non-research teams, with a commitment to build, improve and increase organisational capacity. So within the framework, what we have is definitions of and language, which talks about communication around lived and living experience. Also the principles of engagement, which is something that we don't think has ever been done before. It's an integration of the Aboriginal and Torres Strait Islander principles of engagement and the principles of engagement that were created by our Lived Experience Advisor Network. It also talks about safe and effective engagement and processes for planning engagement. There's also support resources in that framework for staff, and there is things in there around considering readiness. So that also includes readiness for the people, the advisors, the people with lived and living experience working with us, but also the readiness of Black Dog as an organisation to work with people with lived and living experience. There's also a support guide and resources that come with the framework. There's a decision tool in this support guide, and this decision tool was made so that our staff can have a look at what level of engagement is possible for their project. This is really helpful within research. There's documents in there like an action plan and a project charter, which are great documents to go through to have a look at how people with lived and living experience are being engaged, what is their role in the actual project, also what is the role of the staff members in that project. We always look at these documents as being planning for a whole team. So we don't talk about people with lived and living experience or consumers being one thing and then staff being another thing. It's about the whole team and the plan of the whole team together and what everyone's roles are. So what have we learned at Black Dog about consumer engagement or lived and living experience engagement? I'm going to use an example of a digital app that we're in the middle of creating at the moment, and we've been doing it as a co-design project with our advisors, people with lived and living experience. It is an app that's for children that are aged between 7 to 12 years who experience anxiety, and it's helping them go through a therapy called exposure therapy. It's also for parents because we know that with kids, parents are going to be supporting those kids. So with the co-design process, we knew that we would have to have input from both parents and children to make this app effective. Who did we partner with? So the main advisory group that we have together is parents and carers. There's 5 of them. But we also partnered with 5 psychologists, another 5 parents and carers, and we had 5 children who were aged 7 to 12 years. So the first thing we do is we have a project meeting with all of the team. That includes staff and consumers, people with lived and living experience. During this meeting, this is where everyone gets on the same page. We're looking at what the objectives are of the project, the scope of the project, the budget, the timeline, what else is involved in the project. It's about being really open and honest. It's about what decisions are going to be made or what need to be made and what decisions can't be made or what is unchangeable. Then we move on to talking about what is it that the kids are needing in a digital app. We then move on to asking what the parents need in this app, and we also ask the kids this as well because it's important to know what the kids are thinking that parents need to be able to support them. And then we also move on to the next meeting, which is what are priorities for inclusion in the app and what is possible. And this is really an important stage for when you're developing a digital app because this is where we decide what are priorities, what is actually needed by people with lived and living experience, but then what is also possible to develop and what can be put into a digital intervention or a digital tool. Once that happens, the app is then it goes into development stage and it's designed by a UX team or a development team. Then it's the first review of that app that comes, and both the kids and parents and carers look at the first review of that app. Right then there you're checking whether the things that you spoke about in all of the meetings that we had before this have actually been implemented into the app. After that, all feedback is implemented into the digital app, ready for its final look, and it's the second review of the content and the design of the app. And then it's into usability testing. So finally, my key messages about working with people with lived and living experience. So when engaging with the consumers, people with lived and living experience, it's about ensuring that key decisions are being made by people with lived and living experience. You also want to make sure that you're building capacity or skill sets of the people with lived and living experience so they can actually be involved in conversations and they know what is happening and they have the skills to be involved in the conversations. And it's also really about being transparent about expectations and parameters that are involved in the project. So timelines and budget can really be something that affects projects, and sometimes people think that this isn't something that's important to let people know, but people will understand what is happening more if you actually let them know what your timeline is and what your budget is. Thank you.
An amazing presentation from the Black Dog Institute. Thanks, Emma. Next up, we've got Kirsty Oldroyd, who's the Support Services Operational Lead at Beyond Blue. Thanks, Kirsty.
Hi there, I'm Kirsty Oldroyd, the proud operational lead for the support services here at Beyond Blue. And I'm here to share and take you through some key insights and our approach when engaging with our community to improve community experiences and outcomes. Okay, let's get started. So I want to take a moment to share how we create a culture of continuous community experience here at Beyond Blue. At Beyond Blue, we use the KPMG 6-pillar of experience framework and our design principles. So onto the good stuff. We have 2 case studies to share with you. The first is demonstrating how we approached participation design for our support service enhancements, which was focused on improving youth interventions. Case study 1. This demonstrates how we are gathering community insights to improve community outcomes for the support service. We commissioned a literature review by La Trobe University, who exampled the literature on youth interventions for youth to gather evidence on the most appropriate models of care. The review recommended mobile app-based intervention content, flexible in delivery with synchronous and asynchronous support, and interactive content or gamification. These were validated by community engagement to understand how young people wanted to interact with our services. And some key themes emerged about wanting to have targeted, personal interactions, but willing to give data upfront to have a better experience. Conversational chatbots were also seen as a good way to keep interactions going for those repeat users not having to tell their story. We really wanted to understand why young people use digital services, what young people expected, and why young people were choosing Beyond Blue. The literature review provided an overview of the current limitations of the support service, what we'd tested previously, what we'd validated and found. Our post-literature review identified those key barriers and challenges we were facing, enabled us to prioritise the improvement opportunities, and identified what good looks like and what an ideal journey map should look like, along with the aspirations from young people. We heard young people wanted more wraparound supports, greater personalisation of services, and wider choice in how their data is used and stored. We also heard there were key barriers and challenges for people accessing our service, and these included wait times and length of service, personal fear and stigma, support services not being inclusive, a lack of personalised support or tailored care, being caught in a crisis loop, privacy and confidentiality concerns, and returning to services for the same issues. Insights initially taken from community and operational delivery reports, the Net Reporter score on our web chat channel, verbatim feedback from our post-interaction survey. We knew the youth experience on web chat wasn't great. Web chat had a higher percentage of youth users, which was 83% of under 16s using web chat on the support service. And through the literature review, we progressed to validate the research and how best we can use AI technology to improve community experience and outcomes. This is a project in flight and will continue to evolve and improve our youth experience. Case Study 2, Co-Design. This co-design experience was aiming to solve that the COVID mental health support line of Beyond Blue support services did not seem to be accessed by certain cohorts within the community. Arabic-speaking communities in particular were identified as not accessing COVID-related support. We heard that people within these communities are more likely to experience self-stigma and social stigma in relation to mental health, preventing them from seeking information and care. Other barriers included language and lack of familiarity with available supports. Once the scope was set, the first critical step was engaging with participants to co-design. After the engagement activities, we focused on creating the conditions for co-design. We acknowledged there would also be a required investment in both time and resources. We engaged an external agency to help facilitate the co-design experience. Co-design involved community participants and, importantly, subject matter experts as a collective, collaborative group working together. We set expectations with both consumers and staff to ensure we navigated power, time, communication effectively. The favoured direction was for a social media artefact around the topic of active listening as a key support strategy. Other concepts that informed the final artefacts were words to use and avoid when having a conversation with someone about their mental health, as well as advice on accessing professional help. 4 looping videos with key stills for each have been produced. Co-design participants emphasise that being a respectful listener is an important way of demonstrating care and offering the best support. The video showed how to be active, respectful listener when somebody is sharing their mental health challenges with you. This step sought the participants' final approval of the content created. We at Beyond Blue continue our commitment to consumer engagement, further embedding a culture of inclusive, integrated and valued consumer partnerships, aligning with our vision to enable all people in Australia achieve their best possible mental health. And that concludes our approach when partnering with consumers. Thanks.
Thanks, Kirsty. Some great points there. So we've received some questions from the audience and we're going to go to our expert panel to get some answers. So the first question, how can digital mental health resources be utilised to supplement an individual counselling modality? And I think I'll hand that one to Victor.
Thanks, James, and that's a very good question. I mean, first of all, yes, they can, but the really important thing is that people have choice. Service users need to be able to decide what they want, what they need, and the more control that they can have over what service modality they're interacting with, then their path to recovery will fit them better. So digital mental health services can be used in addition to face-to-face direct consultation. They can be used as an adjunct alongside, and in some cases can substitute, but only when that's the choice of the individual, and in particular if they want to be seen in a very prompt and timely manner, and people living in rural and remote regions, 6-hour return car journey is often not practical, so then a digital consult can be a most useful way to go about things. I've found in my own practical experience that it often helps when you've had face-to-face contact in the first instance that people will adjust or agree to an ongoing digital or intermittent digital contact because that suits better for their lives. They don't have to spend so much time in transit. And the adjunct part is, many of our digital mental health service providers have a lot of online material which people can work through to help in their own recovery. In fact, many people go and explore some of these sites like Mindspot, Beyond Blue, This Way Up, for example, and there's a lot of material that people can access, and that's where they often sort of try and work out for themselves what help they might need before they even seek face-to-face contact. So yes, it can be possible, but the most important is service user choice.
Yep, absolutely. That's a really good point, Victor. We've got a question here talking about the language of partnering being the same for service users and service providers. Rachel, what's your take on that?
That's a great question, James. I think that, whether service users and service providers understand partnering in the same way is going to depend a lot on where the organisation or the service provider is on its journey of, implementing a lived experience framework and starting to think about partnering. And it's really important, I think, as I said earlier, to go on that journey meaningfully and structurally and build those systems around a framework, as Emma said, of, let's be a team in this, let's have trust and open dialogue, open disclosure in establishing that. And when you apply that to frameworks like, user experience and design, whether you're building a new type of service or looking to review and transform an old one, if you are genuinely partnering and you can get to be on the same page as understanding partnering the same way a service user would, you'll be looking, the telltale signs will be what makes a good partnership. Is it a two-way relationship? Is the scope clear? Does each partner understand what the boundaries are? What can and can't be done? What exactly are we designing for? And have you got the right group of service users to inform that partnering approach? People who use the current service, people who haven't been able to access it. And do they have an equal voice in the room? Are they being appropriately remunerated for the time? Is the power balance fair? Is it 50-50 or above service users? And is there trust? Is there vulnerability on the part of the service provider? You've got to go into it with the mindset that if during those critical processes of design something is revealed that doesn't work, you've got to be prepared to change tack and walk away.
Definitely. It's definitely a journey by the sounds of it. Okay, so let's see if we can go back to Eileen for that question again. So how effective is digital mental health for service users where they might not be computer savvy? Eileen?
Okay, can you hear me all right?
Yep.
Right, that's good. Okay, well, how effective it is will be a very, I think, individual situation for each person. I'm questioning if it's actually about being computer savvy or what other barriers might be there. Our different speakers have outlined all kinds of ways that we can make things accessible, usable, culturally appropriate, language appropriate, etc. And for any individual, it could depend on how they are on the day, whether something's effective or not. And how effectively you can engage in a digital setting. So I think all those things kind of come into play. Ricky's example about issues that might be managed for the individual. Mim and Simon both outlined the challenges, the flexibility that might have to be there by the service provider, or even it might be about choosing the right kind of digital methods to engage with. Some work for some people some of the time, and others might be suitable at other times. I know in my family, we all use different things at different times depending on how we're coping, and that's been part of my journey as well.
Thanks, Eileen. I think as well with the diversity of different things that are out there, it's important that services are doing their best to meet the standards that are going to be standards that provide, or services that provide safe and high quality care, which is really what the digital mental health standards are about. Okay, so we've got another question from the audience. So what are some ways that people can partner with consumers in evaluating mental health services? Emma, I'll go to you.
So with evaluation, I think traditionally, sometimes organisations think that's their job. And yes, it is, but we can also partner with consumers to evaluate whether we're doing the right thing and whether we're actually doing what we said we were going to do. So something like the digital standards, digital mental health standards, you can bring in consumers to actually go through them with you to decide whether we actually are doing the things that the standards tell us to be doing.
Absolutely, yeah, it's a really important framework, I think. Great answer. So I think we've got time for one more question. Kirsty, I might give this one to you. In your experience in working with service users, what are the barriers for using digital mental health services, and what planning activities should a service provider consider?
Oh, look, I think digital literacy is still a real barrier for many communities and demographics of our consumers. And I think while digital services are increasingly accessible to everybody, it's really important to remember that for many of those communities, particularly called older generations and people living in regional and remote places, there's still barriers of digital literacy that we need to tackle. So for us in particular, in Gippsland, our community members told us that they're really strongly resistant to things like video calls because internet coverage is historically so bad. And that has led to a lag in adoption of some of our services, even as faster internet speeds become available. So we try and tackle that with working with service providers who offer digital literacy services and use these as a bit of a stealth tactic for connecting people to health content and support. I think you should also understand the digital literacy capabilities of your workforce delivering your service and ensure that you adopt a recruitment and training and development strategy that encourages ongoing digital literacy improvements. At Beyond Blue, we've got a particular community of practice with representation from our moderators of the online forums, along with counsellors, coaches of our support service, and our clinical governance advisors, of which many have got lived experience. And as a collective group, they're really enabling the sharing of best practice and improvements for our internal digital literacy capabilities, which I think is really important and integral to making sure you deliver the right service.
Absolutely. Well, there's some great words to end on. So that's all the time we've got for today's webinar. Thank you for joining us. We didn't get around to answering all the questions, so we'll make some responses and the recording available on the Commission's website. Thanks once again.